Hello friends, welcome to PW Meded Next, and I'm Dr. Shonali Chandra, your Obs and Gynae faculty, and I will be taking a small discussion and updation on MTP Amendment Act of 2021. Now, this MTP Amendment Act is important, first of all, because it has come into force, and secondly, in the most recent FMGE exam also, there were a number of questions based on the MTP Amendment Act, and, final year MBBS, and your undergraduate students, when you are going to become registered medical practitioners, this is also very clinically relevant as well. So let's begin the discussion on what this MTP Amendment Act says. Now, initially, first of all, the act was introduced way back in 1971, right? And after that, it has undergone multiple amendments. And the latest amendment is the one that came in 2021 as well. So what does this MTP Amendment Act involves? What are we going to talk about? We're going to talk about who gives the consent, who is a qualified registered medical practitioners who can perform these MTP. What is the registered place? What are the timing and what are the indications? These are the points that we are going to discuss. So as far as the registered place is concerned, you see, all the government hospitals, the district level hospitals, your medical colleges, all these are registered. Okay. But if there is a private nursing home or a private hospital that wants to perform MTP services or provide MTP services, then that place has to get, registered from the government of India, from the district level authority. That is what registered place means. As far as qualified registered medical practitioner is concerned, right? So who is this qualified RMP? Okay, so anybody who is, let's say, a postgraduate or a diploma in obs and gynae, that is a qualified registered medical practitioner. And somebody who has also done 6 months of house job or house surgeon in the department of obs gynae, and in a registered medical facility, he's done this house job or house surgeon posting in a registered medical facility, then that person is also registered. And somebody who's having 1 year experience, let's say, in the practice of obs gynae in the registered medical facility, that person can also get registered himself. And for a MBBS graduate student who is certified and has registered in the state medical registration, then that person can get himself registered if he has assisted in at least 25 MTPs. Okay, 25 MTPs or 25 cases of MTPs at a registered medical center. Okay, so that person who is not a postgraduate but has just assisted in 25 MTPs, that person can only be allowed to do first trimester MTPs. Okay, that's an important differentiating point to note. Now, as far as the consent is concerned, the first question is whose consent is most important. So we can see here, this is a representation of the form C that we are required to fill. Form C is for the consent form. And there is a consent for the patient herself. Okay. So the consent of the patient or the consent of the woman is most important, right? There's only one place for signature, and that is placing for the woman. So somebody who's more than 18 years of age, who is adult, right, and who is of sound mind and can give a valid consent of her own, then the patient's consent is the most important. The husband's consent, on the other hand, is not mandatory by law. Is not mandatory by law. That is also an important point to remember. Okay. And then there can be situations when the patient is a minor. Okay, let's say somebody who is 18 years of age and less than that, right? And somebody, let's say, who is of unsound mind, cannot give a valid consent of her own. Then in that case, the consent is taken from a legal guardian. Consent is taken from a legal guardian. So this is the next important point to note regarding the consent. Okay. Now moving on, the next question is MTP is allowed till what gestation? Okay. So MTP is allowed according to the new MTP amendment laws till 24 weeks of gestation, broadly till 24 weeks of gestation, and only in exceptional circumstances beyond 24 weeks, but broadly yes till 24 weeks. So there is an opinion form that we are required to fill, okay, and that opinion form is this form I, where the registered medical practitioner certifies that this woman is, applicable or eligible for MTP services, and the required registered medical practitioner is asked to sign here also in the information form or the form I form. Okay, so remember here that when we are performing MTP with till 20 weeks, opinion of only one registered medical practitioner is required, and between 20 to 24 weeks of gestation, opinion of two registered medical practitioners is required. Okay, that is another important point to note. Now, opinion of two registered medical practitioners is needed. Once the opinion is made, okay, after that one person can perform the MTP. But opinion, yes, in the consent form, in the I form, opinion of two registered medical practitioners is required. That is very, very important to note. Then what are the indications for termination of pregnancy? Now, this is a form that we are required to fill when we are performing an MTP. Okay, and all these snapshots that I'm showing you are from the records that we are filling in the departments. Okay, now they are also given by the MTP Act, they're given by the Government of India, so you will find them in your family planning postings also. Okay, so we are required to tick what is the indication. So this will help you remember. Okay, so one is that we have to save the life of the pregnant woman, right? So let's say, for example, there is a woman who is suffering from a very severe heart disease, okay, and if she continues her pregnancy, means she may even die, very high risk of mortality. So something like that, a medical condition, let's say, because of which the woman's life is at risk, then that is a valid indication for termination of pregnancy. In order to prevent grave injury to the physical and mental health of the pregnant woman. Okay, now this is the most let's say controversial indication. Controversial, I say, why? Because how will we certify, or what condition is there because of which there can be grave injury to the physical and mental health? What is grave injury? The law is not defining what actually grave injury is. But let's say, yes, let's say, for instance, the pregnancy has resulted out of rape. Then that can be considered as a grave injury to the mental health of the pregnant woman. Okay, so keep that in mind. Now, let's look at the other indication. In view of substantial risk that if the child was born, it would suffer from such physical or mental abnormalities as to be seriously handicapped. So let's say, a woman gets pregnant and we have, ultrasound report showing some serious congenital malformations. And then it is considered that, this child, if born, can have, severe mental retardation, let's say, for instance. For example, when there is the documentation or where there is a diagnosis, now this has to be a confirmed diagnosis, okay? So when there's a confirmed diagnosis, let's say for some chromosomal abnormality like Down syndrome or any other trisomy, then that is an eligible indication for medical termination of pregnancy. Now, as the pregnancy is alleged to have been caused by rape, that is a valid indication. And something very interesting here to note is that pregnancy as a result of failure of contraception, right? Now, in the previous law, before this amendment, for failure of contraceptive device or methods, it was written, the language of the law was that failure of contraceptive device or method used by a woman or her partner. Now this is new, okay? This is new. It is for woman and her partner. Earlier it was woman and her husband. Now it is woman and her partner for the purpose of limiting number of children or preventing pregnancy. So the law itself does not differentiate whether the woman is married or unmarried. Okay, so even unmarried women for contraceptive failure, they can ask for medical termination of pregnancy. So that is an important point to note. Okay, now very important to note here is that if, let's say, the indication is contraception failure, okay, then MTP is allowed only till 20 weeks. Okay, not beyond 20 weeks, right? And then sometimes in your MCQs, they mention this poor, low socioeconomic status. They sometimes mention as among the options low socioeconomic status. Now, low socio-economic status, okay, how low socio-economic status, it is not defined ना. पुअर का कोई क्राइटेरिया नहीं है इसमें कि कितना लो सोशो इकोनॉमिक स्टेटस होना चाहिए, राइट? तो ये बड़ा वेग सा इंडिकेशन होता है अगर देखा जाए तो। और हमारे जो ऑप्शंस है जिसमें हमें टिक करना है, आई मीन ऑल दीज इंडिकेशंस दैट वी आर सीइंग, देयर इज नो क्लियर कट मेंशन ऑफ वेदर लो सोशो इकोनॉमिक स्टेटस बाय इटसेल्फ इज एन इंडिकेशन। अब कोई इतना पुअर है, इतना उसका लो सोशो इकोनॉमिक स्टेटस है कि इफ दैट प्रेगनेंसी कंटिन्यूज इट इज गोइंग टू कॉज ग्रेव इंजुरी टू द मेंटल हेल्थ ऑफ द प्रेग्नेंट वुमन, सो मच सो, अब वो इंडिकेशन बहुत क्लियरली जस्टिफाइड भी नहीं होता है। तो हम इसमें क्या करते हैं, जनरली अगर कोई लो सोशो इकोनॉमिक स्टेटस का भी होता है तो शी हैज़ टू फिट इन वन और द अदर क्राइटेरिया. Most of the times in clinical practice, she will fit into the criteria of failure of contraception. So let's say there is a woman who is of low socioeconomic status and she's with her husband and then some contraception failure happens, तो हम इस इंडिकेशन को टिक कर, इसीलिए आई हैव पुट अ क्वेश्चन मार्क ऑन लो सोशियो इकोनॉमिक स्टेटस. ठीक है, तो लो सोशियो इकोनॉमिक स्टेटस जो क्लियर कट डायरेक्टली कोई इंडिकेशन नहीं बनती है, बट उसको हमें कहीं ना कहीं इंक्लूड करना पड़ता है इन द 5 वैलिड इंडिकेशंस दैट आर मेंशन्ड इन द एमटीपी एक्ट. ओके, नाउ there are certain situations where you can do termination of pregnancy between 20 to 24 weeks also. इसके लिए indications mentioned हैं. Indications are mentioned in the act for performing MTP between 20 to 24 weeks of gestation. What are these indications? Let's say there is sexual assault survivor, okay? There is a survivor of, let's say, rape or incest, then MTP can be done between 20 to 24 weeks of gestation. Let's say, for example, minor or mentally challenged is a special category where between 20 to 24 weeks MTP can be done. Then other indication is change of marital status. ठीक है, चेंज ऑफ मैरिटल स्टेटस का क्या मतलब हुआ? लेट्स से द वुमन इज प्रेग्नेंट एंड देन शी हर हस्बैंड डाइज, राइट, और देर इज अ डिवोर्स, सो दैट इज ऑल्सो इंक्लूडेड between as an indication of termination of pregnancy between 20 to 24 weeks. लेकिन इसमें 2 medical practitioners का opinion लगेगा. 2 registered medical practitioners have to give an opinion. ये बात already हो चुकी है, ठीक है. Then the other indication is major physical disability in the woman. Major physical disability in the woman. In that special circumstance also 20 to 24 weeks के बीच में कर सकते हैं. 2 registered medical practitioners have to give the opinion. And lastly, sometimes in disaster settings or emergency settings on humanitarian grounds, okay, as declared by government, as declared by the government, right? So these are some of the indications जिसमें 20 to 24 weeks के बीच में कर सकते हैं. Then special circumstances when one can do beyond 24 weeks also. Beyond 24 weeks एक indication है, and that is when there is severe congenital malformations in the fetus. ओके कई बार ऐसा होता है कि समटाइम्स जनरली क्या होता है कि जो कॉन्जेनाइटल मैलफॉर्मेशंस होते हैं जनरली वी पिकअप देम ऑन द सेकेंड ट्राइमेस्टर अल्ट्रासाउंड. कभी कभी हमारी कंट्री में व्हाट वी सी इज ना एंटीनेटल केयर इज लिमिटेड, सो समटाइम्स समबडी हैज गॉटन अ लेट अल्ट्रासाउंड डन और लेट्स से द डायग्नोसिस वाज कंफर्म्ड लेटर ऑन इन प्रेगनेंसी. तो क्या करें, राइट? देन इन दैट सिचुएशन इवन बियॉन्ड 24 वीक्स MTP कैन बी डन, बट इन दिस सिचुएशन अब बियॉन्ड 24 हो गया तो क्या लगेगा? इन दिस सिचुएशन दे विल नीड अ सर्टिफिकेशन फ्रॉम अ मेडिकल बोर्ड. अ मेडिकल बोर्ड विल सर्टिफाई. Okay, and this medical board, the law says, is going to consist of a gynecologist, will consist of a pediatrician, will consist of a radiologist, and another member of the government as the government specifies, right? So there will be a medical board that will be constituted, and that medical board will decide कि भाई beyond 24 weeks allow करना चाहिए कि नहीं करना चाहिए. तो इसमें only the opinion of the registered medical practice नहीं चलेगा. We'll need to get a certification from the board. So that is another difference that you need to remember. Now lastly, the important thing that the new MTP Amendment Act clearly mentions and specifies, it was there earlier also, but it is now being enforced with much force, right? And that is on the confidentiality of records. Confidentiality of records. कहने का मतलब ये है that we are not supposed to disclose the name, information and the details of women who are seeking MTP at any point in time except for when the लॉ डिमांड्स अस टू, है ना? कोई हमें गवर्नमेंट ऑफिशियल या कोई गवर्नमेंट या लॉ हमें बोले कि हाँ भी इसको दिखाना है, इसके इन्वेस्टिगेशंस चाहिए या इसके रिकॉर्ड्स चाहिए तो ही. अदरवाइज all the records are confidential. We have to fill an admission register. All the details we have to fill in an admission register, which is also called as form 3, and this has to be sealed. Okay, under no circumstances this should be revealed to anybody. इसको दिखाना नहीं होता है, ठीक है? No other documentation is required to fill. मतलब हमें हॉस्पिटल रिकॉर्ड्स में और कोई डॉक्यूमेंटेशन नहीं करना है except for the documentation that we enter in the admission register. So only this register is maintained. Only this register is maintained. ओके तो इस रजिस्टर में अगर आप देखो तो सारा डिटेल है. सीरियल नंबर, डेट ऑफ एडमिशन, नेम ऑफ पेशेंट, ये वाइफ ऑफ, डॉटर ऑफ, एज, रिलीजन, एड्रेस, what was the duration of pregnancy, what was the reason pregnancy was terminated, what was the duration of pregnancy, date of discharge, right? रजिस्टर्ड मेडिकल प्रैक्टिशनर्स का नाम भी लिखा होता है इसमें कि किसके ओपिनियन पे किया है, हु हैज़ परफॉर्म द टर्मिनेशन, व्हाट वाज द मेथड, एवरीथिंग इज रिटन हियर एक्सेप्ट फॉर वन थिंग जिसकी रिक्वायरमेंट नहीं होती है, एंड दैट इज द सेक्स ऑफ द अबॉर्टस. सेक्स ऑफ द अबॉर्टस इसका कोई डॉक्यूमेंटेशन करना मैंडेटरी नहीं है, ठीक है? सेक्स ऑफ द अबॉर्टस डॉक्यूमेंटेशन इज नॉट रिक्वायर्ड बाय लॉ, ठीक है? और ये इंपॉर्टेंट इसलिए भी है, दिस इज अनदर, सी विद दिस पॉइंट ऑल्सो रिमेंबर दैट अंडर नो सर्कमस्टांसेस, ठीक है ना, सेक्स सिलेक्टिव अबॉर्शन कभी भी नहीं करते हैं, राइट? तो अल्ट्रासाउंड डॉक्यूमेंटेशन ऑफ सेक्स ऑफ द फीटस, सेक्स रिलेटेड अबॉर्शन, ये सारे के सारे दीज आर पनिशेबल ऑफेंसेस, ठीक है? दीज आर पनिशेबल ऑफेंसेस बाय लॉ. अंडर नो सर्कमस्टांसेस दे आर सपोज टू बी डन. ऑल्सो रिमेंबर कि जो रिकॉर्ड हमने मेंटेन किए हैं, दीज रिकॉर्ड्स आर मेंटेन्ड और प्रिजर्व्ड, लेट्स से they are maintained or preserved for 5 years from the date of last entry. From the date of last entry. Okay, and also remember कि जो बाकी तरह के abortions हो गए, यानी कि somebody who has a clinical abortion, है ना, जैसे हम पढ़ते हैं threatened abortion, missed abortion, inevitable, complete, incomplete abortion, है ना, clinical जो abortions हो गए, they are not included in the MTP Act, है ना? जहाँ पेशेंट सिम्टोमेटिक हो गई, जहाँ पे वो थेरेप्यूटिक स्पॉन्टेनियस अबॉर्शन की तरफ चली गई, दोज आर नॉट इंक्लूडेड इन द MTP Act. MTP Act only deals with when a woman comes wishing to terminate a प्रेगनेंसी, उसी सर्कमस्टांसेस में MTP लॉ एप्लीकेबल होता है, नॉट फॉर अदर टाइप्स ऑफ clinical abortions. ठीक है, so that is another important point you need to note, that other types of abortions, clinical abortions, let's say, they are not covered or they are not included or they don't come in the purview of the MTP Act. Okay, so that's another important point to note. और उसके बाद finally last में, once we know all the legal aspects of abortion, let's talk about the violation of the act also. Okay, so violation क्या होगा act का? What will be called a violation of the act? Let's say somebody is not a registered medical practitioner and that person is, performing MTPs or performing MTPs. Okay, let's say somebody who may or may not be a registered medical practitioner but is performing this MTP or these procedures, let's say at an unregistered place, this would be a violation. And the other violation is that इतना सारा जो हमने पढ़ा ना, ये फॉर्म भरना है, वो फॉर्म भरना है, फॉर्म C, फॉर्म I, register, admission register, all this paperwork, this documentation that is required by law to be done, if that documentation is not proper, है ना, तो हर मंथ क्या होता है हमारे हॉस्पिटल से, एवरी मंथ ये सारा डेटा जाता है टू द डिस्ट्रिक्ट अथॉरिटीज. ओके, दिस हमें सबमिट करना रहता है. ये हमारा काम नहीं होता है, नॉट फॉर स्टूडेंट्स पर से, बट जो भी हॉस्पिटल के अथॉरिटीज होते हैं वो भेजते हैं, राइट. सो इफ द मैंडेटरी डॉक्यूमेंटेशन इज नॉट फॉलोड, then that is also a violation of the act, है ना. तो इसमें एक बात खास याद रखने की ये है कि इन दी above two violations, violations कब कॉल आउट होती है? These violations are generally called out, let's say for instance there's an unregistered medical practitioner, ठीक है, not a registered medical practitioner, and he does not know when to perform MTP, how to perform MTP, he's performed MTP and some complication happened and the woman died, है ना. So this becomes a very serious offense, right? That is why in the above two offenses, it is basically what we call as a cognizable offense. Cognizable offense meaning that you can be arrested without an arrest warrant also. It's a very serious offense. Okay, arrest without warrant police can do. So that is also an important point to note. Okay, so these are the important points which you have to consider when we perform medical termination of pregnancy according to the latest Amendment Act, right? The most important points to remember as far as the undergraduate students are concerned, mainly questions will be asked around the timing. Okay, that is something that you should definitely know, right? Regarding the indications, you should definitely know. You should definitely know what are the special indications, when you can do it between 20 to 24 weeks, and one circumstance where you can do beyond 24 weeks. So many times they ask you questions on timing, on indication, questions on consent. They ask you, they are important, right? And little bit detail about record keeping, if you can remember, will be good. So basic record keeping, at least basic forms that are filled, okay, which we discussed, form C, form I, form 3. Just remember the names and just remember, what these forms are, requiring you to document. So that much record keeping basic you should know, right? So with this, I'm going to finish this documentation of MTP Amendment Act. So if you have any questions, you can put them in the chat box. I am going to have a look at your doubts and queries. If you have no doubts and queries, I'm going to end the session for now. So